Welcome, everyone. We've been thinking about doing this for such a long time. A lot of it is because we also want to create community and we want to get the message out there on what is actually on the front lines. Dr. Anthea said, yeah, what is actually on the front line of research and what we understand about dogs. So, my name is Rose. I'm joined by the incredible Dr. Findy and Dr. Anthea, who I met on this journey of learning about and understanding dogs more. So, we'll go into our stories a little bit later on. If you've just joined, welcome. And if you have a minute, click on that QR code. You can just give us a little bit of info about who you are, where you're calling from. And we're going to get started into today's webinar. Before we get started, I think, Anthea, we'll go to the next page. I think we're going to start with an acknowledgement of country. So it's really important that we acknowledge the First Nations people as the traditional custodians and as the first scientists, the first animal guardians and innovators of this land. We acknowledge the Gadigal people of the Eora Nation, that's for Dr. Findy and I, and also the Turrbal and Yugera people of the Mianjin for Dr. Anthea. And on their lands is where our science and research takes place. So I'm going to skip the next slide. On the agenda today, we're gonna have a moment to introduce ourselves because it's crazy that we're seeing us as not just Instagram profiles and we are like real people and we sound a little bit, like we sound like humans. It's crazy that we get to meet each other in this way and not via profiles. We're then going to deep dive into pain and the emotions and behaviors that come from like this experience of pain. There's two cool analogies that I want you to take away from. The first is a Sarah Heath emotional sink analogy. Which Dr. Anthea is going to deep dive in. And then we're going to look at chronic pain in relation to that sink analogy as well. And that's where Dr. Findy is going to come in. At the end, we're going to talk about pathways because, as a preface, it is going to be quite a lot of information. For some of you, it might be a perspective that you've not come across before, and it can be a bit confronting. For me, the biggest change, I might get us to jump. Actually, before I jump to the next page, I'll explain it here. The biggest change for me was when I was fostering little wee D. If you've seen Destiny on my stories, I was a very, very to the dot, very good, well-timed trainer, and I still had that perspective when I was working with her, and it was actually like a little bit of like Findy helping me see this picture of, hey, I think that there might be something more. Like you are doing a lot for this dog, but I do think that there is something more going on. And that's when I was like, it was very confronting to imagine how much more vivid and potentially painful the experience of the animal is. So we're going to preface that it will be quite a lot of information. We want this to be like a gentle and a safe space for being curious, for being open. Um, at the end, we are going to sort of handhold into what are the next steps if you are suspecting or if this narrative sounds quite similar. I'm going to go to the next slide. We want to first say if who wherever you are and whoever you are joining today, you are not a bad parent or vet or nurse or trainer or carer or professional of any capacity. If you don't know about this, I did not know about this. It was this year where I was really challenged to reflect on what I understood and how I interpreted the dog. So you are not a bad and you are not good enough. You are good enough. And the disclaimer we also want to say is the content we're presenting tonight, it's for education, it's for information. It's not a replacement for the service provided by your regular vet and your regular health provider. The dog at the bottom, another dog that's been very incremental to me realizing, oh my gosh, I think more people, we need everyone to like understand how much is actually happening for the dog, external or in like that is aside from our intervention and communication with them. Kare was another dog that I saw as a puppy, and I was so confident that because this puppy had seen a trainer, set for life. Kare, we're gonna talk about him later. Kare, very sensitive chicken nugget, and so much has evolved for him in his emotions, in his experience, that also it is to say that it is such a it's a journey of up and down, and the experience of a dog is more complex than we can even imagine. So I'm gonna ask that we have compassion for ourselves and we just bring some curiosity into, I guess, the chapters that we're gonna go into. All right, next slide, Anthea.
Just quickly, as a bit of a
Mm,
cheeky thing, pat on the back to everyone who's here, who has the curiosity and is showing up to learn more about their animal's experience of the world. You're not a bad
yeah,
parent.
It starts with knowledge. Okay. Quick intro. I'm Rose. You would have seen me on Instagram. I think I put this picture here because I discovered that if I just spread the beans out on the bean bag and made like a dog bed, it's actually very enjoyable for the human. That is my introduction of myself. Dr. Findy?
Okay. I'm Dr. Findy. So I'm a vet and I have a master's in clinical animal behaviour. So I do quite enjoy talking about emotions. That's my main jam. And I recently have undertaken a PhD with the psychology department just to learn a bit more about relationships and things like that so I can help everyone a little bit better. And very timely photo. I do like cats. So this is not exclusive, even though we've
You've
advertised for
said
dogs.
that. You've said that
I
already. Now the
have.
cats are
I
taking up too
have.
much
I
space.
do love dogs. I actually work with dogs. So I work with dogs the most. I work with a lot of shelter dogs, and say RSPCA, greyhounds, and I really enjoy getting to know them. And this is part of the biggest layer I found. It's really a good thing not to miss it and to understand them from that viewpoint. So that's
The
me.
layer being pain, that being the layer.
Yes. Mm.
And Dr. Anthea?
Hello, I'm Anthea. I'm also a vet. I became interested in behavior because I don't know, I just have a really big spot in my heart for dogs and cats that are a bit misunderstood. And I loved learning that when they're showing aggressive behavior or behavior that kind of contradicts what we want to do with them, when we give them a bit more compassion, things tend to go a bit more smoothly. My mind was blown when I learned about chronic pain. And it really interplays, I'd say, most of the cases that I see in my behavior capacity, because I do behavior vetting and GP vetting, have some element of chronic pain that is contributing to their struggles. And there's a lot we can do about that, which I think is really exciting. And we're getting more and more information about how to support them, which I'm like, oh my God, spread the word. Rose asked me to use this photo because it shows how much of a nerd I am. It's a photo of a
I know the
tattoo.
story.
Huh?
I think I know the story. Now
Yeah.
it's clicking in my head. I'm like, oh, that.
We were having lunch and she was like, oh, that's a cute tattoo. What is it? And I said, that's Toxoplasma gondii, the most successful parasite in the world. Because I did my master's on it and I said if I got into vet school because of that master's, then I would get a tattoo of the parasite. So possibly I'm the only person in the world with a tattoo of that parasite on them. But I'm a massive nerd.
Interestingly, very famous in the cat world, this parasite. Not that it's exclusive, again, also affects dogs, but
And
the
it messes with
interesting
brains as well.
fact.
So yeah.
That's right.
But anyway, back to
Anyway,
dogs and
back
back
to
to
dogs
you.
and back to chronic pain and behavior and emotions.
Ready for the next
Okay.
slide, Rose?
I'm ready for the next slide. So the big preface before I hand over to the behavior vets, before I hand over to talking about the emotional sink, I want to first say that pain is not as simple as it's a single experience. We found it, isolated it, got rid of it, it's done. It's not as simple as that. And that's why I work with behavior vets, and it's quite an interdisciplinary approach to find what's happening for the dog, especially when, imagine if you are a dog and something hurts but you can't speak the language to the human to say it hurts. So over a long period of time, pain does funny things to your body, to how you perceive the world, to your sensitivity. And so pain is a physical experience and also an emotional experience. It's defined as an unpleasant sensory and emotional experience associated with actual, like pain could be there, or potential tissue damage. So and emotional, like a conversation being the emotional part, the dog would say, oh my gosh, who is that? I have not seen them before. And you might go, but they're there every day, buddy. What do you mean? They're always there. You've seen them before. And sensory, the conversation would play in something like the dog would say, oh, my back really hurts when I walk. So it's a complex physical and emotional experience. Anthea, I'm going to get you to talk about the emotional sink analogy to go into the emotions.
Sure thing. So the emotional sink analogy is probably my favorite thing to talk about in the world currently beyond the parasite. It was developed by behavior genius Dr. Sarah Heath in the UK. She's a behavior specialist and a veterinarian. And it basically gives us a way to understand our dog's emotional capacity and how different factors and inputs impact that, and also how chronic pain feeds into that. So if we think about our emotional capacity as being a sink, we are all born with a sink. Some of us are blessed with a bathtub-sized sink that can hold so much water. Some are blessed with a kitchen sink, and some get that little sink that you see in the portaloo where as soon as you turn on the tap, it splashes water on your shirt. Not much capacity there. With all of our sinks, we've got a cold tap, a hot tap, an overflow hole, kind of close to the top, a drainage pipe, and in our sink, if we're not actively draining, we have a little plug in place. It's very normal to have water in your sink. If you didn't have water in your sink, you would be an emotionless automaton robotic thing. And I don't think we'd enjoy our relationships with our dogs if they didn't have emotions either. So we like water in the sink. We just need to regulate it. Coming back to our two taps. So our cold tap is emotions that make us feel like we want to engage with our external environment. So these include seeking or desire, care, social play, and lust. Our hot tap are our emotions that make us want to protect ourselves from the external environment. And these include frustration, fear and anxiety, panic or grief, and pain. Everything that happens to us in an individual day will turn on one of our sinks. So hot tap, cold tap. So let's have a look at the day in the life of a dog. We wake up in the morning, we get brekkie in a puzzle feeder, we turn on a cold tap. Then the delivery driver arrives. We're going to turn on a hot tap for that. Bit of fear, bit of frustration. Then for some reason, and this is going to turn on some taps for the humans in the house as well, Barry from next door starts using a hammer on your wall that connects directly before 8 a.m. Very frustrating. Then we might play tug with our dog, and that can turn on the hot and the cold tap at the same time because we've got play and socialization, but we've also got a bit of frustration. So as you can see, even by 8:30 a.m., we can have a sink that's getting some water in there. As we continue to put water in the sink without drainage, we start to get to the top of the sink, and this is where our overflow starts to kick in. If you think about your bathroom sink, it's got that little hole at the top that, if it were to be clogged, would hopefully prevent flooding, but not if this tap was on full blast. We have one of those in our emotional sink as well. The way to determine what we see when we get to that overflow point is behaviors that will decrease our stress a little bit, but won't actually deal with the underlying reasons that we're stressed and the rest of the water in the sink. So in my own personal experience, when I'm feeling like I'm about to flood, I like to turn to chocolate. It makes me feel a little bit less stressed, but it doesn't deal with the frustration from the traffic that morning, or that I stubbed my toe, or I forgot my keys again. It's just brings things down a little bit. If we think about our canine friends, what we're going to see is a displacement behavior. Chocolate eating is a displacement behavior too. It's a behavior that is a normal behavior in an abnormal context. So I'm not eating chocolate because I'm hungry. For dogs, what we see is lip licking. They haven't got anything on their lips, but they're licking. It is a social cue, but we see yawning in the absence of exhaustion. We see shake-offs when there's actually nothing on their coat. And it's just their way of slightly bringing the water level down a little bit, but not actually draining the sink. If input continues, we're at risk of flooding the sink. And when we flood, we see our 4 Fs, which are fight, flight, freeze, and one you might not have heard of as much, which is fawn. This is the people-pleasing aspect. I see it a lot in patients that come into my clinic in a GP capacity, and it's the dog that's like, oh my God, hello, it's so good to see you. And they don't pause to interact. They bounce off you over there and back, and they're like, oh, that is almost flooding because they've had quite an overwhelming experience coming into the vet clinic. Drainage is where you're probably thinking we should go next because our sink is full. It is species specific. So if we think about our human equivalents, we would do breathing exercises, yoga, meditation, and also hanging out with friends who make you do belly laughs. You know that feeling where you're just like, oh, that was great. For all of our species, quality sleep is something that really drains the sink well as well. For canines, we've got sniffing, licking, chewing, quality sleep as well. And then quite a fun one, which some humans find frustrating, that Caro will do a very good example of, is shredding.
This is Saturdays at Auntie Rose's. I go, hey, what's bothering you this week? And he goes, and then just blows up the room with several paper bags. Just yes,
It's
do
Caro
enjoy
confetti.
this. It is, it is. The cleanup is it's an experience, but
Yeah, putting water in your sink. I
it's
often,
emptying his sink.
yeah,
And
exactly.
yes,
I'll
that's why
often
you,
hear,
yeah,
oh, yeah,
sorry.
sorry.
You never buy indestructible toys.
Yeah, because it's so therapeutic. I was going to say, I often have clients be like, I buy them soft toys and they tear them to shreds. And I'm like, oh, canine therapy, love that. So good for them as long as they don't swallow it. But yeah, indestructible toys don't allow that outlet of shredding. So if we think about the sink, in our human minds, we'd be like, oh, new day, new sink. No, time is a human concept. And so unfortunately, the sink doesn't refresh after 24 hours. If we don't drain it, it continues to be full. When we have a chronically full sink, we then get chronic stress. And here's a little list. We will send you the slides, so you don't need to memorize these or anything like that. And there won't be a quiz at the end. But some of the important things to kind of note are sleep disturbances, increased perception of pain, and also illness secondary to chronic stress. So if we don't get to drain our sink regularly enough, or if our input is too much all the time, then we're going to experience chronic stress. Let's link back to chronic pain in that case. It's like a leaky tap. We, as human caregivers to dogs, can't actually tell how big of a sink we've got or how full it is at any time in our dog. And so if we have patients that are kind of very easily flooded or very easily triggered, it tells us that there's something constantly contributing to the water in their sink. And also dogs with chronic pain will struggle to drain their sink as well. And so we've just got these dogs that are teetering on flooding and then they flood, and then they go back to teetering on flooding and then they flood. So that's the emotional sink analogy. I thought we'd take a quick breather because it's a lot to process. Has it made you think about anything with your dogs? Is there something that you're like, oh my gosh, that is why Barry is frustrating on Tuesdays, because on Mondays, Freddie, my dog, goes to daycare and he doesn't get to drain his sleep. Doesn't get to drain his sleep. Doesn't get to drain his sink because he's done 16 hours of running around with other dogs.
I
Feel
think
free to go to
you
Slido.
must be, as vets, you must be working. We are working very hard. It's time to drain, and we're using it to spread information of joy.
Yeah, exactly. So yeah, we'll jump over to Slido and we can answer some questions if you guys have any.
I might even. Oh, yes. Was that Curti? Did you say something? Okay, all good. But I was going to say we can extend this as well if you feel more comfortable with like asking in the chat or even unmuting and asking while we're here. That says that we can do that as well. Or you can ask or add your reflections on Slido.
And we can even, if you think of questions later, we can collate a few and do like a second session where we answer your questions. Because I don't know about you guys, but I like to digest
I know.
information.
I do. I
like
do
to
as
digest.
well.
Yeah, I also like to ingest and then digest.
Yeah, right?
Okay, so first question is any suggestions for shredding? I
Ooh.
will go. I always get paper bags because I forget to bring reusable bags sometimes. I'm very sorry to admit this on camera, but I will save the paper bags and I will leave it like a little bit tied up for the dogs to shred. Other suggestions for shredding? Boxes as well.
This is a bit of a weird one, but I was at I used to work at a behaviour clinic in Adelaide. Shout out to Polly Understood, they're amazing. And we used to reuse all of our medication boxes for shredding. But I was at a human chemist a few weeks ago and I saw their recycling was full of those little different, it's very thin cardboard and it's different sized boxes and shapes. And I was like, oh, if someone like wanted those boxes for their dogs, could they have them? And they said yes. So ask your local recycling people.
Like making a box pit instead of a ball pit. Box
Yeah,
pit.
yeah, with treats and things in it.
Dive in.
Another thing people like to use is lettuce or cabbage
That's a good one.
because it's a bit digestively safe. You can also, if you don't think that please supervise your dogs. If you don't think that your dog will eat it, you can fill one of those mesh balls with shreds of fabric and they can kind of shred the fabric out. But we can make a list if you guys like. But good question.
Another quick question was if we can't access the QR code, is there a web link? I've just posted it in the chat and then you just type the number in. The number is that on the screen. Good questions. Another reflection. We've had some mentions of some dogs have to be or have disrupted sleep at night, so it might stop the dog from draining properly. And an interesting thing, it's often something we say in consults, is when you look for a dog that's resting, a sphinx rest is a very different rest to a dog that's on their side, conked out. A sphinx rest, it can also look like a curled sphinx, is a dog that's like, I'll close my eyes, but I'm listening. And when it happens, I'm ready. So yes, like the quality of sleep, it can affect the drainage for the dog.
I
Meeting
like to
yet an
say we aim for that nap that you have after like a big family lunch where you've accidentally fall asleep on the couch and you wake up and suddenly everyone's gone. And you're like, what? Okay, right. Instead of like, oh, Uncle Barry's leaving to go hammer the wall again and like, but I'll just keep my eyes closed. You want that dead to the world sleep.
and by the way, if we don't get through some of the things that we mentioned today on the chat or on Slido, it will be on our records and we'll readdress it on stories. So I'll post a few Instagram stories on Q&As or on frequently asked questions if it's not addressed today. Um, oh, what someone asked if chronic pain/fatigue is a factor.
We
In
then, oh, sorry, you keep going.
Oh, I was just clarifying, but you can go, Findy.
I think I just haven't even read the question. I apologize. I was just saying, is this a good segue to actually go into chronic pain? Is what I was trying to suggest.
That's good. That's good. Okay, we've got such good reflections, and I'm going to respond slowly, but we're going to dive into Findy. We're going to go straight to chronic pain.
Okay,
I'm
gonna
Shall I stop sharing?
Yes, we need to do some technicality things.
The context for this was I tried to be the person to slide share and then to do the slide changes, and they were Dr. Findy and Dr. Annie said, "Do not. The timing's not right. Delivery doesn't work. We're going to do it ourselves."
The brain is different. That's all. The brain is different.
That's fair.
And we can't expect that. Okay. Am I still shared?
Do the enlarge.
Shared? Yes.
You have, and then do the enlarge.
Hang on. I'm just okay. Does this work for everyone? Is this sharing?
Looks good.
Great. So before, I know this is about chronic pain, but before we go straight into chronic pain, it'll be very good to go through pain first so you understand the definition of it, and then everything will make more sense. So that's what I like to do as clinicians. We always have definitions. So pain, again, as Rose has mentioned, it's defined as an unpleasant sensory and emotional experience. And and the important thing is it can be associated with actual tissue damage, like actual injury, or potential tissue damage. So what it actually would look like as two categories, because you've got two types. You've got the actual tissue damage and the potential. So that's the two different type of pain that we're going to go through today, mainly focusing on chronic pain, because acute pain is very easy to understand as a concept. So acute pain is exactly like this meme, which Rose selected for me, and I thought that was quite good. Intense feelings, actual threat coming in, fire in the hole, you run for it, and then you're safe. So this acute pain is like an alarm system that is working well. It's telling you something dangerous, get out of there. Okay. And then the alarm system stops. So that's your acute pain. Now, chronic pain is a little bit more complex. So it is exactly also what these pictures show. If I think Rose can be have a side job of illustrating. So chronic pain is from the outward, really everything is in normal context for most people around you. They go, oh, you're just sitting in a chair in a home, everything's lovely. But what it actually feels like for the dog is, oh, everything's on fire, or not actually on fire, but it feels like everything's very dangerous, nothing's right. So that is the conclusion of what chronic pain would look and feel like as a visual. Now, how we like to illustrate it a little bit more, especially in the human, this is through human research with chronic pain, is probably, it started way earlier than what we've recognized in the veterinary world. And I find this analogy very helpful. So they use an alarm metaphor. So pain is like an alarm. So as I said, acute pain, you have actual tissue damage or injury. Pain is like an alarm. You tell the dog, hey, something's sore, you got to move away. Moves away, safety, no more alarm. The pain alarm job is done. In chronic pain, what happens is it's a pain that persists for at least 3 to 6 months. And again, really important to remember, initial cause may or may not be present. So just because, say, you've done your x-rays, you've gone to the vet, and your vet goes, no, there's not a cause for it to be painful, it doesn't mean that you're not a chronic pain patient. In fact, it's part of the definition is you still can have all these things that, even if you don't find it, doesn't mean that you're not. That's a really important thing to remember. And everything in terms of chronic pain, why it is so complex is because chronic pain or this persistent pain actually changes the brain structure and processes. And the main one to really try and understand or know about is something called central system sensitization, which is what the brain, so if you're always in pain or think that you're in pain, what the brain is trying to do is wants to be a pain expert for you. It wants to eliminate it by sensing it really quickly. So it changes all its structures to do that for you. And as a result, you get this really heightened sensory experience. And it's this kind of process that really changes everything for the dog. And that's why it's a physical and emotional experience. So again, the alarm system as an analogy, so we can just have a bit of a visual. Your acute pain is an adaptive functioning alarm system. You have fire, real threat, pain goes, go away, move away, and the dog moves away and it's safe and there's no more alarm. Then we have chronic pain. It's a maladaptive response. So what we call a malfunctioning alarm system. It's oversensitive. That alarm that rings in the middle of the night and you go, what's that? It's a moth flying through or walking past. That would be very similar as to what's happening. So it actually starts from here. So you've got your central system sensitization because there's persistent 3 to 6 months worth of pain. Then you have heightened sensory processing because of it. So when there's no existing threat, still got an alarm, and you've got a creature that's doing things as if it is feeling pain because of tissue damage, but they might not be. But they might be, but they not be. So that's chronic pain. It's very complex. In the human world, the approach they use to describe and model chronic pain is they describe it as a biopsychosocial syndrome or condition. And what you need to remember is why it's these 3 aspects. It's because it's mostly all contributed by this central system sensitization. Brain is trying to absorb try to absorb a lot of bottom down information, gets all the sensory information to try and eliminate pain. And then, but it's top down modulation going, it's okay, it's not that great anymore. That's why it's a malfunctioning alarm. So as a result, you get these 3 aspects either being affected or they kind of influence each other because the brain is it's actually quite an amazing organ. You never want to upset it because it starts to learn. It's very organic. and they start to influence each other. And then you have permanent biological changes as well. So we'll go through each one of these in just a little bit more in depth. So we've got our biological changes, are actual brain changes because of this central system sensitization. And what the physical symptoms would feel like because of these structural changes is either you feel more pain at a painful site, so hyperalgesia, scientific term, if you want to sound a little bit smart like a doctor. If you don't worry about it. We all know what you mean. Then you've got allodonia, which is, it shouldn't be painful. It's a non-painful thing, but now you have a decreased pain threshold. So all of a sudden, sometimes it will feel painful for something that's non-painful. And then you have the third one, which is, it's a bit shocking to learn about this one, but you have spontaneous pain. So all of a sudden you feel it and you're like, oh, because that's your alarm misfiring. Rose, you have something.
I was going to say, one
Yes.
of I remember in the consult for Kare, one of his biggest symptoms was that he would go from sleeping and like really restful sleep and just out of nowhere, he jumps up and it's not a stimulus that any of us could pick up, but it would just be interrupted sleep. And he was very scared. Like he just wake up being very, very terrified. It wasn't something that we can pinpoint. So this spontaneous pain, it matches.
Yeah, it's
Yeah.
quite wild. And in humans, actually, there's a test that they would do if you say, I think I have chronic pain. What they would do is they'll rub a cotton ball on your hand. And apparently for some patients that do experience it, they'll say it feels like a knife slice instead of a cotton wool ball because that hyperalgesia, it's that strong. I'm not saying that, again, interspecies. This is just an example. We do parallels just so you can relate. But the dog experience is different because it's a different species. And also I always remind Rose when at first I opened her eyes and she was like a little bit overwhelmed. The dog is also very resilient. They're not humans. They might have that perception, but they perhaps might cope a little bit better. So it's actually more hopeful, even though it is awful. So that's something to be really mindful of. It's just all these human things. All I want to do is just help you relate. So it feels more real when we see behaviors from the dogs, and this is what we're thinking about. Okay, so that's the physical, the bio side of it. And then psychologically, which is my favorite bit and Anthea's favorite bit, is there are emotional changes because structurally you do have changes in certain centers of the brain. I won't go too deep because Rose said everyone will fall asleep. So there's two main centers that really is affected that is causing these emotional changes. And some of you might know it. So it's the amygdala and the hypothalamus. And both of them are really important for emotional responses, particularly those big feelings. And I love Rose's illustrations. Like these are the big survival feelings. You've got anxiety, you've got panic and grief, and you've got frustration and rage. So because of those changes, and the hypothalamus is actually for defensive strategies to threats. So it's actually because there's so much increase in these emotions, overall, the animal just doesn't feel safe and they don't feel well because there's a lot of it happening and you generally get a very full sync really easily. We'll go through each of these emotional changes just a little bit more because it's actually quite good little examples and little facts about it. So we've got fear and anxiety, that's increased. And in humans, they actually experience something called pain catastrophizing, which is, it's characterized by the tendency to really magnify the threat of a potential pain stimulus. And at the same time, they feel very helpless about this presence. Like they feel like they can't do anything about this pain. So why I want to illustrate that is just, pain is very real and it can cause, like it's very dynamic with that anxiety because it's to do with survival. So you will have a dog that has a very increased or disproportionate amount of fear and anxiety if it is in chronic pain or chronic pain is part of the layer of this dog. Then we have, I think we were talking about it and
Yes.
Anthea had a really good example about pain catastrophizing.
Oh, yes. Actually, I wanted to clarify as well. The
Yes.
word catastrophizing sounds like it's made up in your head or that you have a
Mm.
choice on how you process how you feel about the pain, but it's actually, like you were saying, physiological changes in the brain where you don't have a choice and it kind of just happens naturally that you have that increased perception and worry about pain. Was the example you were talking about I think it's about the frustration and rage. So I might
Oh,
just
okay. I'll leave it.
up
I'll
to
leave it. The next one. We'll go with the next one, and then I'll go, Anthea, that was a great story about it.
that.
Um, so frustration and rage. So how that changes with central system sensitization is brain changes again, but the circuits for regulating anger and frustration are the same circuits or overlapping at least for pain. So in animals, what we find is they would think or perceive that it's very hard to access resources, or they think that the resource is actually more valuable because it's harder to get. There's a cost to it now. Like you've got to think about how to adjust yourself, how to move, how to have it, and then make sure no one else would get it because it's really hard to get it again. So they'll have that perception, and they might a lot of you have increased frustrated related behaviors, which is like being really demanding. Like usually they're like a Labrador. You go, oh yeah, I know you like food, but the Labrador goes, no, no, and you go, wow, that was a bit much. I know you want it, but that almost feels a bit rude now. And that's actually a response of increase in frustration. Of course, not every frustrated dog will have chronic pain, but I often think, if you have, again, it's all like the syndrome. So we're kind of collecting all the flags and going, oh, you're ticking a few boxes. Maybe we should think about chronic pain. And particularly with frustration, if you feel like your dog is very demanding or you're starting to label it as like, you're being the alpha, you're trying to dominate me, you're trying to make me do things. It's actually something to think about. It's to do with frustration. It's not the dog actually being so personal. And it's something they might not be able to control because there's actually some biological changes to do with it. And another interesting fact, really, before I say, Anthea, tell us that story, is in humans, what they found if chronic pain patients, if they suppress their anger expression, if they're not allowed to express their anger, it actually exacerbates the pain that they feel. And in the other side of the coin is if you are in positive emotional state, so seeking, curious about the world, like to play, and you have reinforcements like food, it actually alleviates pain, which I really want to share this fact to everyone because it comes back to our support strategies later on. But yes, there was a really good story that Anthea can tell us about chronic pain and how there's an increase in frustration.
So this is one of our human examples. Unfortunately, it has
Yes.
no dog in it, but or cat. But I experienced some chronic pain with a shoulder injury a few years ago, and it would wax and wane, and I couldn't really track what made it worse. But there was one particular night where, and I often just cuddle a pillow when I'm sitting on the couch, so it wasn't abnormal behavior for me, but I was resting my elbow on a pillow sitting on the couch, and my partner unknowingly reached out and his feet tapped the pillow that my elbow was resting on, and immediately my brain went, but I had to take a moment and be like, he doesn't know that I'm really sore today, and I'm just gonna say, could you please not touch the pillow? And because I know about chronic pain, I was able to be like, I know why I did that. But I was thinking, it made me think about all of my patients who have that knee-jerk reaction or are so much more sensitive. Like after that, anytime I had the pillow, I'd start to shift away because he might stretch his feet out. And
See,
so,
that's your anxiety. You've got frustration,
yeah.
and then it happened, and you're like, oh, maybe.
And it was really,
Mm.
that almost came out of my mouth. And he would have been very shocked. But yes, so I'm sure if we think about it, a lot of us have had experiences like that where we just haven't been able to cope with something that is quite benign happening when we're that uncomfortable.
Yeah, I enjoyed that story. Again, the second time is even better. So then, okay, we go to the third one, the third little emotion, panic and grief, which is to do with relationships and your attachment to your caregivers. Also, very interestingly, chronic pain and pain pathways, the neuropathways and circuits, they overlap with social pain. So when you have a dog that has really chronic pain patient, or you notice, like, I don't know why my dog, I've tried so many things, but it just cannot be independent or cannot be alone or cannot, like, must need to be with me. Again, patients I see, I would rarely say it's the carer's fault of, indulging a dog or whatever. Most of the time there is something happening that is biological, that you can't fight it. And we must acknowledge there's other layers potentially influencing it, particularly if you've tried already. I would say if you've tried, stop trying for a bit because it's hard for everyone. And then have a think about, is there something else? Because once I learned that fact and I started to see, like, sometimes when, I've had patients that have separation related anxiety and they were stabilized, and then 1 year, 2 years goes on, don't hear from them much, and then all of a sudden they reach out again and they say it's escalating again, but we're doing everything the same that worked the same time. And then when we look deeper, it's quite often there is that chronic pain aspect to it. And when we address it, which we'll talk about in approaches and things like that, is once we address it, you don't have to do anything else. The dog's feeling better. We've helped with all these emotions that are underlying with it, that are sharing the same pathways, and the behaviors just become manageable again. So it's just something I really want to share so you can start recognizing that it is a potential. It's not always, but it is a potential to think about. So that's
I will also add, I might also add, just
yes.
from those 3 points, that was also where I realized for Kare that there's more going on for him, was his behaviors. Initially, it's easy to perceive, oh, he's a golden retriever and an adolescent. This is a very normal process, but like a lot of his behaviors, which I would have interpreted differently before, are actually more likely to be frustration related. And anxiety related. Even when he goes into sniffs, it's like frantic, like I need to get information in case this is like life threatening.
Yeah.
But again, the item is like a car that he's always seen is there.
Yes.
Anyway, that was
Yeah.
my
Great. Yeah, it's good. Also good. I think Kare is a very good example, actually, as like him, especially now. I think he's got a diagnosis, hasn't he? Especially with that, it just is a very good case study.
He's our poster child.
He's our poster child. He's so pretty too.
Yeah.
He's well taken care of. Again, he's very resilient, and he's got social support. So this good segue. Can't find it better. The third thing that happens with chronic pain is you've got this social change aspect because of all the biological stuff and then the emotional stuff, and it's all one directional. It just goes both ways. Because again, this is a very dynamic process, is what we need to remember with chronic pain. So again, we'll go through each one in terms of the little emotions. So with anxiety, because you've got this kind of sudden influx of, oh no, I don't feel safe. You might see your dog socially that's really intensely fearful. Or like you go, I think someone's hit him before, because he's always like, not always. Sometimes, again, there are these layers of the dog that we should and really think about, because when it's so out of context, it could be, yes, traumatic experiences, but equally, because chronic pain is an emotional experience, something really we should think about. Then the second one is with anxiety is because you tend to get so defensive, their choices generally are they will choose repulsion. I think we haven't really gone through, anxiety, there's 4 behavior, blah, 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 but if you see a dog that chooses to be defensive or become aggressive, or repulsion is just really they want to push someone away, so to increase space so then they feel safe. So when a dog is anxious and fearful to that extent, they are more likely to choose that because the rest is going to take too long because this feels like really life-threatening. So the social changes is maybe these are the things that you'll see. You're like, oh, why are you so aggressive all of a sudden and just so rude to everyone? Or like, why are you so scared? We're just going out to do a wee. And you're like, oh my God, I can't do a wee. So
That was Kare. That was Kare for
yes,
like his entirety of his 7 month mark was he couldn't pee or poop in the backyard. His motor patterns were like we have to walk and then it will happen. And I hate the walk, but that's the only way I can pee. That was very significant. Anyway.
yes, that's very significant.
I love
Yeah,
the example you gave, Findy, as well, when we talked about it before, about the dog that goes out and does the poo, but then
yes,
comes back inside.
yes.
Could you go through that again?
Yes, that is actually perfect segue, Anthea,
Ooh,
to frustration,
it's
how
like
it
we
relates to
planned it.
social change. And we learned it. We did. So frustration, how it impacts on social changes is, again, because things are harder, then your resources are more valuable. So you will tend to resource guard a lot more. Depending, of course, on your relationships with your caregiver and how much they, know you and understand you and things like that. But you will have a higher tendency to want to guard, whether it's space, whether it's people, anything that they hold dear, all of a sudden it might be more valuable because of that increase in frustration. Then they will have also this reduced capability, which we always look for. I always ask clients, what makes Terry Terry? Tell me where you go, oh, it's cool, like he's just a really cool dog. But this thing that Terry does, I want to know that. The thing that Terry does that makes him Terry, I would like to know little anecdotes and stories about that. Because quite often, dogs again are very resilient. If there's a task, they will do it. They'll make it happen. And how they do it is they compensate. They kind of like shimmy it to make it happen. And sometimes if they really can't do it, that means that the end of their kind of resilience and capabilities, and they'll go, I can't do it. So you might see a dog that's, walking midway and then just sits and stops. And then people go, oh, he just stops. And then they just wouldn't listen to me. Sometimes that's to do with that frustration and reduced capability, and they just can't do it. And I'm saying no. And the other time, which is that toileting example, is you have a dog that, going out, mum goes like, all right, come, let's go out and do a poo walk, and then we'll, come back in and go for a sleep. They don't know that. It looks really simple. Go out, do a poo, come back, sleep, do it every day. But the only difference is maybe there's a little hill, or like the texture of the floor is a little bit different. And that dog, that day is having a hard time physically, uncomfortable, and that hill really is hard. So you got to squat and walk through a hill, and then squat, and then poo, and then walk down a hill and to go back home. So at the end of it, you might have done your poo, and it takes longer. And he was like, can't believe it. We'll sit here for like 10 minutes for you to do a poo. This is usually just a 2-minute job. And then you go back home, and the dog goes, I'm going to wee here now. And then you go, oh my God, I can't believe it. Why? We just went out, and you come back and you do a wee. It's because of that, again, that frustration, anxiety, capabilities, all of that. It's just a perfect example of chronic pain when you see that kind of loop. And I think why I'm really excited to give this a talk is I just wish that people would recognize this more, so they don't blame the dogs, they don't blame themselves. You can be frustrated, like it is very frustrating when you've just gone out for a wee walk, done so long, you just want to go to bed and the dog wees, and that's fine. But rather than taking out a dog and thinking there's no good reason, there is sometimes a good reason. And if we investigate more, sometimes that will solve everyone's challenges with it.
I think as well, dogs
yeah.
that are labelled as stubborn can sometimes fit into this group.
Yes. In my questionnaire, we go, what do you think about your dog? And when they go, stubborn, doesn't listen to me, I'm not in control, I go, you have a frustrated dog. So frustration is the emotion of no. So that's really good to remember as well. Emotion of no means behaviors are very quick to escalate, and they tend to be more intense. So with that, you will get social changes. It's harder to build relationships, or you have a frequently like kind of a relationship rupture that you feel like, that was really bad. What happened? Why did it happen again? Do I really like you? Why do you not like me? So that kind of change.
Sorry to interrupt. Can we just circle back for a second? With the dog stopping walking it during stopping mid-walk, what's the best way to go around that?
Well, sometimes it's just to wait with them and then go back home.
Okay, so after they do that, just go straight back home?
Yeah, the moment's over for whatever reason, in my perspective, either emotionally or physically. My biggest concern is when dogs suddenly, they like walk, they usually walks, but this one they go, no, I would listen to the dog. You can ask questions later, but in that moment, listen to the dog, go home. Tomorrow when it's woken up, great day, try again.
Yeah.
Bring different things, problem solve. And if it still happens and you've already optimized and made it better, I would often have the question mark of why.
Okay.
Okay.
And in terms of actually, like if we do have to move and go home and the dog is saying, I'm frozen, completely full stop, I'll put on my Instagram story an example of how, I guess from like a handling, what we can do just to help the dog get
Actually,
to move
greyhound
along
owners are very good at having strategies for that.
for
Because
the
greyhounds
freezers,
love to,
inhibitors.
they actually not just stop, they also intensely inhibit. Yeah, I can't cope anymore, and they freeze.
Because sometimes with Obi, when I am walking him, he will stop because he also wants to go a different way. Like, for example, to the dog park, or he wants to go a certain way. And then if he doesn't get his own way, he will either plant his feet or just lay down. So in that situation, just best to take him straight home.
I think that's very context specific. And I think we probably have to do it a little bit individualized. But in those kind of stories, often what I interpret is your dog is frustrated about something.
Okay. And how's the best way to handle frustration?
Lots of different ways. That's another, like,
I think that's
that
a
we
whole
can
nother
note
webinar.
down. It's like one of my favorite ones too, frustration. And it just will go on for too long if you let me dive into it. Rose is like, stop here, Findy, don't more, no more.
I do want to like I guess move us towards that Q&A, like the second sort of breather, because I think a lot of people are going to have questions at this point of like, oh my God, a lot of things are resonating.
Okay, so I'll just make it's almost finished, so we can definitely go. Just let me finish this bit with my little emotions or icons. We're up to, so that's anxiety, frustration. The third most big one in terms of protective bias emotions are your separation related to your panic and grief. So again, it would just be that dog that finds it very hard to separate and feels very unsafe when their primary caregiver is just even walking away from the same room as them. And often, these things will then intensify more of these things. And then when you're not feeling safe, you might feel more pain. So then that will change ongoing. So that's all how the cycle goes through. That's why it's a syndrome and quite complex. And then this ties us to, this might be a dog that you might recognize that has all of these or some of these or a combination of these. So say biologically, what you might see is a dog that has no sensitivity, can have strong phobias, is very intense. You've got touch sensitivity to the point that you think you're just going to give it a pat as normal and they come out and go, no. So think about when that happens, not always it's to do with chronic pain, but if we're in the context of chronic pain, think about that human with the cotton ball. Sometimes that's what that dog might be saying to you. You've got equipment avoidance, so harness avoidance or certain things that they get really like, ooh, once the harness is on. Those things. That's why I think I was talking to Rose, like, I think we should do something like that, a walk, because there's so many layers about it. It's not just to do with, the handling skills. It starts from how comfortable a dog is with equipment and things like that. And it's very telling sometimes what's happening. So the last one of the biology is like, Anthea was, and I would see it a lot in that sense, that would ring alarm bells, is something called abnormal repetitive behaviors. So it's similar to your OCD behaviors in humans, and it happens, it's just an indication that your emotional state is very heightened and your arousal is very high. And what you'll see will be behaviors like tail chasing or like stargazing, or like that golden retriever that, eats too many rocks 3 times in a row and needs 3 surgeries in a month. That rings alarm bells for us as behavior vets. We go, why is this happening so much? That's an issue. So that's something to consider. That's the bio side, like the physical side that might affect a dog, and that might be a dog that you'll see. And also that same dog might have that unexpected repulsion behavior towards people they know or dogs they know. You have dog fights. You go, why you love each other? Generally, grew up all of a sudden you hate her every now and then to the point that you want to kill her. Why? So that would be something to consider psychologically. You got separation related distress, resource guarding, as we mentioned, stealing, demanding, that kind of frustration related behaviors increasing. Reactivity is a really big one. Whenever there's like, you go, oh, a dog cannot be walked, and it just is very extreme in its behavior to dog, or territorial aggression, where people can't come into the home, and then emotional dysregulation, which is your big meltdowns, or like flooding sink. That's Anthea's little explanation for us before, and sleep challenges and disruption. Socially, you might see again that learning the dog that you go, I know you can do it, but I don't know why you can't remember, or like you can't concentrate to do a lesson. Householding is very common. And so again, is the relational side of it. So difficulty finding relationships, often ruptured relationship with caregivers, like if you are a caregiver and you feel like this is hard, sometimes it's not to do with you. I would really like you to explore a little bit deeper, because, you know, sometimes it's not to do with the people. It's actually the dog telling you they're not feeling well. That's why their needs are all increased. So that's a summary. So this might be a dog that you go, oh, I do have a dog that, you know, I've seen as a trainer, they have one or more of these problems and it's hard to manage. That's an extra layer to explore. Yeah, that's it. I think that was a lot. And usually that's like in our little rehearsal, we thought maybe that's enough to just have a little break.
Can I ask you to say one thing that you said in the rehearsal, which was amazing?
Yes.
Sorry, I'm like, oh, what you said that. The thing you said about if, like, the load of managing a dog.
Yes. Yes. So that relates to if you're feeling like that it's hard to take care of this dog, and you feel like your needs are encroached as a human, I want you to explore whether your dog's okay physically and whether it is experiencing chronic pain, because quite often that is a very big flag for me, especially like all my little admin people that help with my calls. When you first call in to book, they often, that's a guide for them that they know this might be a medical dog, and they'll ask you about their medical history and things like that, because it's very common. If you feel very frustrated with your dog, or you go, I can't even go for a holiday without stressing out about my dog, they're really common flags that, you know, you can explore more with people, but know about chronic pain. Did I say it, Anthea?
You did. It was beautiful.
Great.
Let's say it again.
Wow.
Okay, I will stop sharing so then Rose can share.
Wait, stay here.
No, okay.
Stay here, and then I think you can keep sharing from your slide.
Okay.
Yeah, that was big. It made me think about with Destiny, if you were part of like my Instagram when I was fostering Ouija, and I was very exhausted. There was like mornings where we wake up at 4 a.m. was very difficult for her. 4 a.m. she's like, ah, and even as we adjusted medication to support her, it wasn't like it just felt like a lot. Like she was very hands-on in multiple of these brains on sensitivity, on like sleep and ability to like form social relationships, to learn and to retain that as well. Yeah, but yeah, this opportunity is a good one if you had reflections on what resonated with you, even questions. Again, if we don't get through all of them, and I'm noting everyone's down, we'll go
there's
through a
been
bit
lots
more
in
of a
the chats.
Q&A.
I hope you are.
Lots in the chats.
I have missed 40.
It's it's okay.
Okay.
I think I'm really curious about this one, but I do want to sort of jump ahead and answer a big question, which is what's next. We've got really interesting questions, but I think
a lot of people are asking, what do I do if I suspect, like,
okay, well, we can
with
jump to that.
Yeah.
And then we can answer questions after.
Yeah, that sounds good. All right. Well,
really
should I jump?
Too.
Should we jump? Is that jump? Are we concluding to jump to the next one? on approaches.
On approaches, yeah, the next steps.
Okay, so burning question. How do we help our dogs now that we know? And it is very overwhelming. Like, I think I didn't know about this for most of my vet career, to be honest. And I've only started looking into it in the past 3 or 4 years when I started behavior. And then I got exposed to Dr. Sarah Heath and Sarah Fisher and all these beautiful people that know so much about dogs. And once I opened my eyes, you really can't unsee it, which can be very overwhelming. And I found this approach really helped me a lot. But I'm a clinician, so I'm very kind of this step by step, but I like to introduce it to you. And it might work for some people, it might not. So 3 steps is how I think about it in my head. The first thing is recognition. Like, you need to be able to observe that there are flags and recognize it. And, you need to have animal professionals that can support you and go, yeah, I've also seen these things about your dog, and you group them together. You go, I think we have this biopsychosocial syndrome that we need to think about getting more help. And in the human research, what they found is the first barrier to getting help for chronic pain patients is recognition. So that's why Rose and Anthea and I were like, we got to just at least tell people about it. That's probably the first step. And then for anyone who's really interested, we've actually designed a program for everyone, just so we can go in depth to each one, and it can be more personal and individualized, just so we can help you and guide you through that kind of approach and journey. Because quite often even the recognition bit becomes quite overwhelming, but that's very important because you need to know what you're looking at, and you know that it can correlate to something that we can help with dogs. Second step is diagnosis, which is, I like to call it, you got to assemble your Avengers. Usually when I've grouped everyone I need for a dog, I go, oh, Avengers complete. And we've got everything with it. And that would include, so in my own little team and my contacts, I often have contacts with these people as well, because one cannot do it alone. It's a very big problem to solve. So people and professionals that you want to gather help with would be, say, your behavior vets, your veterinary behaviorists, your clinical animal behaviorists. The difference with those, I think Rose has a really good little reel on her Instagram recently about it. Physios, physical therapists, dog trainers, and dog trainers now you can get a certification with CAM, so Canine Arthritis Management. They're a really amazing group of people from the UK who really just look into and dive into arthritis and chronic pain management. You can do a course with them, you can get certified with them, and that's a really good signpost, I think, for carers to look for when they need support. General practitioners are vets. They're wonderful as well, and you really need the help, because part of diagnosis is you will need some diagnostics, you'll need people who can dispense meds for you, have quick contact with things aren't going well in between, having optimized those management plans once we know maybe if we do find an inciting cause. Like, they're very, very helpful as a resource. And one thing that I forgot, because I should have listed as professional, but now thinking it'll be your friends and family that would get to know your dog, like your actual support village is very important, because you need to have it encourages on your knees with that load, and you really need to share it in order to help your dog, which I think Anthea and Rose would both resonate with that I've left that out, but it's equally important. Back to that note of assembling Avengers, Anthea actually came up with a really good list of some hot tips of selection criteria, or at least, the signage you want to look at for choosing professionals. So I'll segue to you. I'll stop sharing.
Oh,
should I stop sharing, or should I?
To the next?
I can just click it too.
Yeah, that'd be great.
Okay. All right, there you
go. So I made this list because I mean, all 3 of us have had a time where we didn't know about this, and I'm sure all 3 of us can think of patients that we've worked with previously where we're like, oh, that was chronic pain and I didn't know about it. And so in your journey of trying to assemble your team, you may come across people who are either not informed or just are not the right space for you to go through that journey with them. So I thought I'd make like a little list of things of what to look for, and they're green flags for people who will help support you in that journey. So they should be open-minded and curious and never dismissive. So we don't want to hear, he's a drama queen. Like all dogs like this are just drama queens. That to me says there's no curiosity there, and they're not like, okay, why is this such a struggle for this patient? I like to see that they're willing to connect you with other professionals to make a care team. I think that a good professional will be humble enough to know that they cannot tackle this entire problem by themselves. And this kind of ties into the next line as well, but they'll be aware of their own limitations. So, for example, in my GP job, I only get half an hour or 20 minutes to kind of go through chronic pain with my clients. I don't know how to do physio. I know it does amazing things, but I know my limitations. And actually, I know that my physical exam is not as finessed and exceptional as the physio that I like to refer to. She picks up things that orthopedic surgeons I know wouldn't pick it up. Oh no, my words.
Sorry, fiddling. Keep going. Distraction.
I can't do it without the words.
Ignore.
We want someone who believes you and validates you and supports exploring it. So again, if you have started down that journey and you've had someone say, look, there's nothing on x-rays, there's nothing wrong, let's find someone else. It may be that they don't know what they don't know, and they may not know about chronic pain. We are not taught about it in vet school. As Rose and Dr. Findy said, we all came across it by working with other professionals. I think the thing that we really focused on in vet school was acute pain. And even previously, I've worked in specialist hospitals where I worked with orthopedic specialists, and they are so amazing at treating acute pain. They're like, bone is fractured, plate bone, fix, support with pain then. But they don't know as much about chronic pain because, again, even in specialty, in the orthopedic side of things, it's not that explored. Good clinicians will ask you to collect data from your home environment because they will know that adrenaline and cortisol will mask certain things in a clinical setting. So when I was at the behaviour clinic in Adelaide, I'd have an hour and a half to do a consult, and I would often find at that like 80-minute mark, I would start to see the true way that the dog was moving through the room. In one dog, I started to see like its ankle tremor, and I was like, does that happen at home? And I'd been watching the dog the whole time, and it just finally relaxed enough and let go of that adrenaline and cortisol that had masking, that it started to show how it really moves. So filming your patient or your pet at home gives you a much better idea of how they truly move, and changes in movement and gait are really good information on how comfortable we are. Which brings me to knowing the difference between chronic and acute pain and how it interacts with the body, mind, and nervous system, which is what Dr. Findy went through. And they need to also know that managing pain isn't something that you just flippantly chuck drugs at. One drug alone won't really do enough to address chronic pain. It needs to be multimodal, and it needs to actually reach that central sensitization, which is what Dr. Findy was talking about, the brain becoming a pain expert. The medication needs to actually send messages to the brain to be like, hey, it's all good. We can turn that alarm off. And it takes between 8 to 12 weeks to actually get medication to have that impact on the brain and the nervous system and to start unlearning that stuff. But medication alone will not get you all the way. They need physical therapy, environmental modifications, medical support, and social and emotional support as well. So if you have a clinician or professional who's like, well, just chuck them on a joint supplement, that'll help a little bit, but it won't really support us in the long term. This is something like this last quote is something I say to my patients, but I guess anyone you interact with should have this kind of ethos of, it's not up to me to say that your animal isn't in pain. It's my duty to make sure that they aren't, whether that's by doing treatment trials or investigating. I mean, most of us would be delighted if we were like, I have a suspicion of chronic pain. and we went through all of the avenues and it wasn't chronic pain, we'd be like, cool,
Yeah.
great, glad.
Great.
I'm
That is
glad
really
we made
good.
sure. Yeah. Because a good professional wouldn't want to miss it, is my point, I guess. So yeah, that's it.
That's it.
That's a
That's a
die
great
on.
point. That's a great point.
Got it.
It's a great point. And it really goes to what you said is really that third step of the approach. Once you have your Avengers, you've gone through some diagnostic processes, you know what we're dealing with, and maybe say, yeah, it is chronic pain. Because chronic pain is that physio, emotional, social, you really need those three areas that Dr. Anthea has said. And if you just remember a bit to what I said about the fear and frustration bit, especially the frustration, if you suppress it, it makes the pain worse. So even if you don't have the full diagnosis and things and all that, I think it gives us another really valid piece of data to say when we teach our dogs and communicate with our dogs, don't try and suppress, really try not to use punishment because you don't know how much impact it actually does beyond the surface. And you're really trying to get that emotional support so the dog actually feels heard because it's such a social problem. And I suppose it ties in also, I just one last point with that little bit is what I think Fiona was saying, what do I do with frustration? Frustration is an emotion where when there's a barrier, frustration to a motivation, frustration comes out. So you really want to prioritize the plan for your dogs in every area is to prioritize that ease and comfort. You need to make things easy, not harder. So if my dog eats fast, you don't want to give them a slow feeder. You've got to think about some other delivery that is not so frustrating when you're already hungry and your brain's telling you, do things that are really, really fast. You don't want things to stop you, but other ways to slow you down instead.
I've got a post on Instagram that's enrichment versus decompression. That would be like a good, I guess, like a good example of what is, when frustration's in the picture. Okay.
So that's our 3 steps. And we have something really good to support the first step.
I guess this is a good time to I guess go back to the beginning where pain, again, it's not just like we figured it out, found it, it's gone, but it is an investigative journey. And the behavior vets and I were thinking about how can we make this support accessible? How can we also work with your current regular vets to help them with information, with data, so that, and to help you feel valid as well in your observations. So if I jump to the next slide, initially, like normally how we work is if you've consulted with me, I might have referred you to a behavior vet and then we work together and we sort of figure out the case around that 3 to 6 month mark. I guess, to make it more accessible, we wanted to do like live small group classes where we actually fill out a really important data collection sheet called, it's made by Canine Arthritis Management, CAM, and it's what we supply to your regular vets to supplement in observations in data to supplement their information gathering. So as an example, for Rico, when he did a board and train, this was one way that I filled out a lot of changes in his posture, in his behavior, capability, gait, which is exactly what we talked about before, like the biopsychosocial changes for him that then get supplemented to his vet visits. But what we're doing is in December, we're going to do, starting from the first Sunday of December, Sunday mornings, there will be this package is a 4 week of 4 Zooms on the 4 Sundays in December. And if you want more information, link is in my bio. But this is like the kind of deliverable that we want to be able to help you with. But yeah, I know it was.
We have lots
Anthea?
of questions.
Yeah.
There's a couple that I think would be really good to dive into, but also there's been a bit of a chat in the chat about gut pain. You can apply pretty much everything that we've talked about up until this bit here to any discomfort. So generally, if we're investigating, like if a dog is presenting with inability to emotionally regulate and they're struggling or they have that heavy burden of care, we say, okay, what sort of leaky tap do we have here when we can't actually see what externally is setting them off? And so that's usually gut, skin, musculoskeletal, and sometimes more rarely neurological. But all of the things we've discussed do apply to that, apart from this slide, because our course will be focused on musculoskeletal discomfort.
But usually, I would say the gait and posture differences, you can highlight gut pain, not all the time, but it would give you some inkling as well.
Yeah, it's true.
So, I mean, the format we take is we're focusing on the musculoskeletal. But yeah, I agree with you. Often when we screen in our consults, it's often, I often think skin. You have skin issues, you have gut issues, and how are your legs?
Yeah. Or
And
neck, or back, or
What's your whole body? And then you go, where do we start? And you go, that's another story that we need to go through. Where do we start? But yes. So it's very exciting. Really look forward to people signing up, because we just really think it will be very beneficial to do things in a group. And the more the better, so we can help more animals.
and
this
if
is
people learn things, they can then pass it on to other people as well.
That's right. Pass it
Be
on.
like, in my dog, I saw this and this and this.
Yeah.
Have you considered this in your dog?
Yeah.
Okay.
So we just dive a little bit deeper, and we get a little bit more personal with your dog, which is always great. Yeah.
Shall we go to some questions?
Ooh, there you go. Oh, I am conscious of time. I think we might have to do
time as well.
A jot down in Q&A.
Yeah. If you do have a question, I might maybe just pop it in the chat, and we're gonna store it, and we're gonna slowly filter through them and then make them stories on Instagram. But yeah, feel free to just type it in the chat if you have, I guess, last questions that are coming up for you. But everyone's asking really good questions so far. I think I'm wondering as well if you have feedback for what you took out of this, what was insightful, if it was helpful or not. You can also type it in the chat, or you can add it as an anonymous post on Slido. But yeah, this would be the conclusion of our webinar today. We did go over, but we're really grateful that you've come over with us.
Yes. Thanks for coming.
Thanks for joining us, everyone.
We'll see you next time. Talk about cats and frustration.
Bye-bye.
Bye.
All right. Bye-bye.